because the session is being recorded. Want to thank the campus teams and the coordinators for your participation. We also have a number of judges from past events and sponsors who are listening in. Want to thank all the sponsors again, and particularly welcome you to this 10th annual event, which, as Dr. Williams said, is not quite what we expected. Now I'd like to ask each campus coordinator to identify their campus and each team member briefly, just by name. Start with Meredith College.
Good morning. I am Stephen Benko. I am one of the coordinators of the Meredith College Ethics Bowl team.
And would you please have the other two coordinators introduce themselves and then introduce the 4 team members?
Lisa, Cheryl.
Hi, I'm Lisa DeLeese, also one of the coordinators for Meredith College.
And good morning, I'm Cheryl Jenkins, also one of the coordinators from Meredith College. And I guess we'll have the team members introduce themselves.
Right, thank you.
Hi, I'm Elena Blackwolder, and I'm a team member for Meredith College.
Hi, I'm Scout Birch, and I'm a team member from Meredith College.
Hi, I'm Safa Ahmed, and I'm also a team member from Meredith College.
Hello, I'm Linda Yeager, and I'm also a team member of Meredith College.
Okay, Montreat College.
Hi, I'm Mark Wells, and I'm the campus coordinator for Montreat College.
Would your team members introduce themselves, please?
I'm Luke Livonius. I'm a team member at Montreat College.
I'm Matthew Kaufman. I'm also a team member at Montreat College.
Good morning, I'm Caleb Wells, and I'm a team member from Montreat College.
Hi, I'm Caroline Courtney, and I'm a team member from Montreat College.
Thank you. And Salem College.
Oh, we have 2 more members.
Oh, I'm sorry, I apologize. I'm trying to rush through it and I don't mean to. Thank you for correcting.
I'm Rebecca, and I'm a team member from Montreat College.
Hi, I'm Peyton Landy, and I'm a team member from Montreat College.
Welcome. Okay, now Salem College.
Hi, I'm Spring Duvall, and I'm the campus coordinator at Salem College.
Hi, I'm Khadija, and I'm a team member from Salem College.
Hi, I'm Jasmine, and I'm a teammate from Salem College.
Hi, I'm Mariana. I'm from Salem.
Hi, I'm Abigail. I'm a team member at Salem College.
Any more from Salem? Okay, thanks. William Peace University.
Hi, I'm Scott McElreath, campus coordinator for William Peace University.
I'm Samara Demery from William Peace University.
I'm Chase Elliott. I'm a team member from William Peace University.
I'm Rachel Ashworth. I'm a team member from William Peace University.
Hi, I'm Reed McKeel, and I'm the final team member of William Peace University.
Thank you. And as all of you know, the case is going to be the COVID vaccine. I'd like to remind everyone that the cases were written this summer, so some data may seem a little bit outdated. Now here's the way we're going to try to work this. I've got the names of the 4 colleges in a bowl. Hope you can see it. And I will draw one out, and that team will go first. And let's see. We have 7 minutes. And at the 6-minute mark, I will hold up this sign that says 1 minute. 7 minutes presentation. And at the 6-minute mark, assuming my timer works correctly, I will hold up this sign 1 minute left. Okay, I will draw. I'm supposed to hold it up so you'll make sure I'm not cheating. William Peace University will go first. And I will say start when you may begin.
Hello, everyone. Thank you for being here today. My name is Samara Demery, and I am again from William Peace University. My teammates are Chase, Rachel, and Reed. We follow a 6-question model for ethical decision-making, which was adopted by our university. Our model goes as follows, starting with our question, what is the ethical question we are trying to make? Followed by relevant facts and information that helps us answer the question, points of views and interests, our values and principles, options and sequences, and finally our answer and explanation. Some relevant information and facts for this case that we found were that the CDC has gone forward with their plan for vaccinations to be distributed, and they have structured it and put everyone into classifications as follows: healthcare workers, essential workers, high-risk people, adults over 65 and older who don't fall into the previous listed categories. Herd immunity will limit the virus, so not every citizen needs to be or has to be vaccinated. Getting the flu shot, as we've seen, reduces illness 40 to 60% and prevented 4.4 million flu illnesses in 2018 to 2019. We already have to get immunizations as students, and schools already deny entry based on vaccination records. An estimated 33% of people who will refuse the vaccination. Unvaccinated children are more likely to be uninsured and have less access to healthcare, which leads to 15 to 30% more likely to get vaccinated with private insurance. This is a case-by-case scenario, as some businesses may require masks and some may not. And we can't make something mandatory until everyone has the chance to get the vaccine. There becomes a risk in asking people if they have or haven't been vaccinated and may affect their privacy and rights. Now I will pass it to Chase, who will talk about our points of views as well as our values and principles.
So first, for perspectives, we have schools who want to safely get back to in-person learning, but they may need to require students be vaccinated. We also have all levels of government who their main priority is to keep people safe and healthy while also respecting their rights. And then we have healthcare officials and researchers and distributors who fairly equally and morally want to distribute vaccines. We also have healthcare providers who may receive incentives to push vaccines, but they also want people to take the vaccine to stay healthy. We also have citizens who have a range of perspectives. Some are positive about the vaccine and some are negative about the vaccine. And then we come to businesses and their employees. There's the question if they should require vaccines for their workers or for their customers. For some of the values that we went over, in this case, we had honesty, compassion for individuals, trust in our government and others, the well-being of constituents, and public safety. But we have to balance that with individual freedoms. So some of the options that we came up with was to, one, not make the vaccine mandatory. With that, there may be accessibility issues or a lack of vaccine to go around. There's also safety concerns about the vaccine itself and about COVID numbers going up. We may not be able to open schools and get back to normalcy if we don't make the vaccine mandatory, and COVID numbers could continue to trend upward. Another option is making the vaccine mandatory, which may be hard to enforce. We are worried about the vaccine being distributed in a timely manner, and as we said, everyone needs access to the vaccine before it can be mandatory. There's also the issue of how you prove that you got the vaccine. Do you need to have a card or something like that? And people who don't want the vaccine, they may protest, they may riot or be unhappy about it. So now I'm going to pass it to Rachel for the option that we chose and our general principle.
So our group decided that the best course of action is to allow individual businesses and organizations to decide if their customers or their members should be vaccinated in order to enter a location or to participate in a group. And instead of a moral theory, we came up with a general principle that applies to the situation. And so our general principle is, if a person is in a situation in which she can implement a policy that is in the best interest of public safety and promotes the well-being of individuals, then it is morally acceptable for her to do so. So, for example, though the federal government might not require individuals to be vaccinated to enter federal buildings, a small business owner might require their customers to be vaccinated to enter and shop at the business. I work at a long-term healthcare facility. So currently, when you get the first dose of the vaccine, you get a card, and it has the date that you got it, the provider, and the brand of the vaccine. So you bring this to the second dose to be updated, and it's a small, easy way to show that you have been vaccinated. And so we also came up with an example that supports our general principle, and that example is having a law that requires us to wear seatbelts when we're in moving vehicles. So this policy is in the best interest of public safety and promotes the well-being of individuals. So we would say it's a morally acceptable law. Wearing seatbelts is shown to protect individuals from further harm and has become a normal aspect of our society. And wearing a seatbelt evolved from a recommended practice to a legal requirement. So vaccination may or may not follow a similar path, but until then, we think that businesses and organizations should be allowed to decide the best course of action for themselves. So I'm going to go ahead and pass it to Reed for an objection to our general principle, as well as a conclusion of our case.
So we anticipated that some might object to our principle by stating that a vaccine requirement would hinder personal freedoms and disallow moving freely. To this, we would remind our objectors that we are still giving organizations the choice. We are not stating that it is morally obligatory for these organizations to implement mandatory vaccine requirements. The organizations will still be able to make that choice. And in conclusion, we've heard from Samara, who gave us an overview. We've heard perspectives, relevant values, and options from Chase, a general principle from Rachel, and an objection from myself. We used a 6-step decision-making model to determine our principle that if a person is in a situation in which he or she can implement a policy that is in the best interest of public safety and promotes the well-being of individuals, then it is morally acceptable for them to do so. Thank you.
Thank you. Now I need to reset my time. Okay. Now we'll draw for the second college or university. Salem College will go second. Salem may begin.
Thank you, NCICU, for having us here today. We're Salem College, and we will be discussing the ethical considerations of placing limitations on people who have not been vaccinated against the COVID-19 virus. Firstly, we would like to assert our stance, which is no. We do not believe it is ethical to place limitations on people who have not been vaccinated, especially right now, because distribution and access to the vaccine is not available to everyone. Now I'll pass it on to my partner, Khadija, to talk about our first ethical principle.
Thank you, Jasmine. We'll first use the ethical principle of value pluralism to frame our argument. This principle states that more than one value may be equally correct, fundamental, and worthy of respect, yet in conflict with each other. In this case, we recognize the importance of public health, which is the aim of vaccinating as many people as possible and limiting the movement of those who have not been vaccinated. However, we also recognize the importance of equity, which can be infringed upon when prescribing limitations on people who have not yet been vaccinated due to the sheer number of impediments that currently prevent access to the vaccine. These two ideas can conflict with each other when we think of them in the absolute sense. However, value pluralism allows us to see that both the goals of maintaining public health and fostering equity are important, even when at first glance they may seem contradictory. Secondly, we'll strengthen our argument with the multi-pronged ethical theory of principlism, which balances the ideas of autonomy, which describes free will and agency, beneficence, which describes the goal to do good, non-maleficence, which describes the goal to not do harm, and justice, which describes the goal of social distribution of benefits and burdens. By not placing limitations on people who have not been vaccinated, we can balance the ideas of autonomy, beneficence, non-maleficence, and justice. I'll begin by describing beneficence and non-maleficence in this context. In not placing limitations on people who have not been vaccinated, it simultaneously does good and does not do harm by not punishing people for their varied situations. For example, according to a regularly updated NPR tracker, only 4.9% of the US population has received both doses of the vaccine. Limiting the movement of over 95% of the country would be unfair, inefficient, and unlikely. I'll now pass it on to my partner, Abigail, to discuss further the theory of principlism.
Thank you, Khadija. I'd like to start by talking about autonomy. Placing limitations on people who have not been vaccinated places an arbitrary restriction on people who have probably not been given the choice to take the vaccine. It would create an unfair exercise of autonomy for some people and not for others. For example, preventing unvaccinated people from entering public places would lead to an extreme bias in the sheer number of people who could exercise their autonomy and grant some individuals, regions, or professions more right to their autonomy than others. While the goal may be to incentivize people who otherwise would not get the vaccine due to personal fears and objections, the effect is punishing people who may be unable to access this vaccine. I would now like to pass it on to my partner, Mariana, to talk further about the justice aspects of this case.
I will now touch on the last idea of principalism, which is justice. The vaccine distribution process is lengthy and staggered, and will likely be so for months or years to come. As such, it is unjust to restrict movement based on certain people's access and others' inability to access the vaccine. When examining this dilemma from a global perspective, it is clear that countries with emerging economies do not have the same access to the vaccine as countries like the US, and will likely remain so for years to come. This causes an unjust power dynamic that endangers lives of people in poorer countries. According to the CEO of the Serum Institute of India, for at least 90% of the planet to be vaccinated, we will be waiting until at least 2024. Further, research by the Duke Global Health Innovation Center found that high-income countries currently hold at least 4.2 billion doses of vaccines, while low to middle-income nations hold only 670 million. Their limited access to vaccines means that it will take a longer period for each person to be vaccinated. It would therefore be unjust to place limitations based on vaccination status if the vaccine is not equally accessible to all. I will now pass it to Abigail to touch on the legalities of this argument.
Thanks, Mariana. We would like to acknowledge that American states have the right to require vaccinations as well as restrictions for unvaccinated people as a result of the Supreme Court case Jacobson versus Massachusetts in 1905. However, a production of a vaccine should meet its demands before restrictions are put into full effect. For example, efforts to create a polio vaccine began in the mid-1930s, but a successful vaccination was not created until the 1950s. Because initial production was limited, requirements were not implemented until well after. Currently, all US states in the District of Columbia require school-age children in public schools to receive polio IPV vaccine, according to the CDC. There are also a number of countries that do not allow entry without proof of vaccination, such as yellow fever. These examples highlight the potential examples of limitations for unvaccinated people that would be appropriate, but they are not likely to be put into effect until well into the future. I would now like to pass it on to my partner, Mariana, to propose other alternatives.
The more ethical route here for the current situation would be expanding and continuing other informational campaigns in the meantime to reduce the spread of the virus until there is more consistent and reliable availability for vaccines to everyone. Other mechanisms exist that individuals and companies can take to offset the inability to access the vaccine and can continue to reduce the spread of COVID-19. Encouraging people to continue practicing hygiene techniques like consistent hand washing, wearing masks, and social distancing, all which have been shown by the CDC to reduce the risk of contracting COVID, can be efficient alternatives. This can also include providing COVID testing when necessary. By encouraging educational campaigns, it could help to make people less wary of the vaccine so that by the time it is available to most people, they are comfortable receiving it. Some communities of color are apprehensive about taking the vaccine because of historical context in this country. A survey conducted by the CVS Health found that 4 out of 10 African Americans are hesitant to take the vaccine. This discomfort is justified by historical medical malpractice, such as the Tuskegee syphilis study, where hundreds of Black people were denied treatment of the curable disease. I'll now pass it to Khadija to close.
Thank you. In conclusion, placing limitations on people who have not received the vaccination is unethical due to the principles of value pluralism and principalism. It is important to balance multiple principles when coming to a decision that considers public health, but also recognizes the many contexts and struggles presented by this pandemic. One of those problems is that vaccination distribution is slow and currently inaccessible to many, not only in the US, but globally. Therefore, it is vital that we recognize placing limitations on unvaccinated people is not the best course of action because this places some of the most vulnerable people
have to call time. Now we'll draw for the third team. Meredith College will be third. Okay, Meredith College will start now.
Thank you to the facilitators who are here with us today, and thank you to our fellow colleges and universities. We're really looking forward to having this conversation with you all. So to the question of, is it ethical to place limitations on people who have not been vaccinated for COVID-19, Meredith College asserts that absolutely yes. Working under the assumption that the COVID-19 vaccine becomes widely available to all people, if those people refuse to take the vaccine, then the government has the responsibility to serve the greatest good by placing them into a compulsory quarantine. We believe that this answer is served by a utilitarian perspective and taking utilitarianism to its natural and logical end. So for some background, utilitarianism is an approach to moral and ethical decision-making that has an emphasis on optimizing outcomes instead of motives and promotes the betterment of society. Under this theory, every human is an equal moral being, and it focuses on the greatest happiness principle, which states that actions are right as they tend to promote happiness and wrong as they tend to promote the opposite, essentially the greatest good for the greatest number of people. Good can be defined as pleasure, happiness, or utility. What Bentham means by pleasure is the absence of pain or the increase of good feeling, and this would be equivalent to not contracting the COVID-19 virus. Second, happiness is the full flourishing of a human being, the expansion of intellect, and the ability to act as a rational human. And so we believe that vaccines serve this by allowing people to go back to living normal lives and building the economy in America again. So that leads us to the third good in utilitarianism, which is utility. This is public usefulness, and it makes society more efficient. We think that placing people in compulsory quarantine when they refuse to take the COVID-19 vaccine serves the greatest good, and we will support this answer using historical evidence and the studies that we have already seen on the vaccines. I'm now going to pass it to my teammate Scout, who can further elaborate.
Thank you, Elena. So as my teammate stated, our first point is historical evidence supporting our argument. So Typhoid Mary was a cook who was associated with the spread and infection of thousands of people with typhoid. She was asked to either choose a new profession or begin washing her hands so that she would no longer spread the disease. And she refused, so she was placed in compulsory quarantine. And as Salem College pointed out, Jacobson versus Massachusetts established that this was constitutional. Chief Justice Harlan wrote that the possession and enjoyment of all rights are subject to such reasonable conditions as may be deemed by the governing authorities of the country essential to the safety, health, peace, good order, and morals of the community. In Mary's case, the Department of Health took away her career and her freedom of movement for life because she refused to adhere to their rules and to protect the safety of fellow citizens. We believe that this serves the greatest good because it's protecting the majority. Furthermore, she had an option to either pick a new career or start taking hygiene seriously so that she could continue in the career that she had. Similar to this, those who exist in the COVID pandemic have the option to get the vaccine. And if they refuse that option, then they are subject to government action so that the greater good can be protected. Another example of this is leprosy colonies. These colonies were established to protect the greater population from the spread of leprosy. And we've seen in both of these cases that quarantining these individuals greatly decreased the spread of the various diseases. So we believe that this applies in this case because quarantining those who willingly deny the vaccine will serve the greatest good, and it will not harm the minority because they are given an option of getting the vaccine. And with that, I will pass it on to my teammate Linda, who will expand on our argument.
Thank you, Scout. So our second point is that there are other vaccines that people have encountered throughout their life. So their concerns about the COVID-19 vaccine are unfounded, considering the research that has been done for the COVID-19 vaccine. Additionally, this concern is unfounded also because we know that vaccines work and that they prevent the spread of certain diseases like COVID and even like the flu. Secondly, we know that there is a potential concern about our solution concerning communities of color, and that there has been a history of the government targeting communities through false health campaigns. However, we know that nurses have worked to establish this continuing trust by providing flu vaccines at the beginning of the pandemic, so that when the COVID vaccine became available, these communities had a more healthy relationship with healthcare providers. This connects back to our theory because the greatest good is served by people getting vaccinated, and because most everyone has received a vaccine in the past, it is reasonable to expect people to get this vaccine as well, especially when the relationship between the BIPOC community and healthcare officials is being repaired. And I will pass it on to my teammate, Safa.
Thank you, Linda. Meredith College would like to acknowledge that we understand that an objection to this argument could be tyranny of the majority, which John Stuart Mill, who created utilitarianism, was the person who came up with tyranny of the majority being a possible issue. However, it does not apply to this case. We're not taking away the minority's life, but instead we're taking them out of a situation that could cost someone else their life. The cost to the minority is going to be much lower than the threat to the majority, and therefore the objection of tyranny of the majority does not apply in this case. We are not just protecting lives, but also the economy. The pandemic has had significant financial consequences to many people. COVID is one such disease that you can pass without knowing that you have it, and therefore you can infect multiple people without knowing that you are. We also would like to acknowledge that people who are quarantining can at any time be taken out of quarantine when they decide to get the vaccine, if they decide to get the vaccine, just like Mary would have been taken out of quarantine had she chosen to wash her hands or stop being a cook. Thank you for your time.
I guess there's not a great deal of suspense about the fourth team. Montreat College will be our fourth and final presenter. Montreat, you may begin.
Good morning, facilitators and fellow students. Thank you for discussions and insights on the COVID vaccine and its distribution to the masses. To answer the question, is it ethical to place limitations on people who have not been vaccinated for COVID-19? Montreat College holds the position that it would be appropriate to have limitations under certain conditions. The conditions are as follows. The general population will need to have had the opportunity to receive the vaccine. We will need to know more about the immediate side effects of the vaccine. Healthcare workers should be required to receive the vaccine. Public schools should be required according to the governing body's mandate, or private schools may decide on their own terms. Also, when herd immunity is reached, limitations may be reconsidered. To further our argument, my teammates would like to delineate on the terms as well as relevant ethical theories. Matthew will discuss the right of conscience and equality under the law. Rebecca will discuss the necessity for healthcare workers to receive the vaccine, as well as exceptions to these limitations. Peyton will consider the role of private businesses in regard to the COVID vaccine. Luke will then examine our moral obligations concerning the vaccine, as well as the balance between liberty and safety. I'd like to pass it on to Matthew.
Thank you, Caroline. We take the position that the federal and state governments both lack the just authority to enact restrictions on individuals broadly because they have not received a vaccine. It was argued in the creation of our nation that the right to conscience is one of the inalienable rights to which all people are entitled. This right was then enshrined in the First Amendment and is upheld to this very day. To inflict broadly upon the population mandates for medical treatments, which might and do go against some people's religious and moral convictions, is a violation of this sacred right to conscience. A violation which a government claiming to adhere to the high-minded and universal principles of the Bill of Rights cannot justly impose. Furthermore, placing on everyone restraints for necessary everyday activities based on access to a novel vaccine is in danger of violating the principle of equality under the law. Some people equipped with greater wealth and status will find gaining access to the vaccine a trivial task. By contrast, those who lack sufficient transportation, free time, or live in underprivileged communities may find it very difficult to access the vaccine promptly. In the meantime, however long that may be, the law will be specifically discriminating against those of lower socioeconomic status. In order to talk about the medical implications, I'd like to hand it over more to Rebecca.
Thank you. So as Matthew was saying, we do have a problem with placing broad limitations. However, we do believe that placing limitations on healthcare workers is necessary. The reason we make this exception is because we see that healthcare workers consistently interact with people who are at higher risk, whether this is the elderly or young or people who are otherwise immune compromised. In this case, it is in the best interest of all that they be vaccinated to protect those that they interact with. As well as dealing with this, we also say that there should be some exceptions. This isn't new. There's exceptions for vaccines now for people who are known to be immune compromised and may react to a vaccine, or who have had vaccine reactions in the past and are concerned about reacting to certain ingredients or components of this vaccine. And Peyton will continue.
Thanks, Rebecca. So as Rebecca stated, the Montreat College point of view is that we do require healthcare workers to be vaccinated, but on the stance of private businesses, we say that they have a choice. We believe that the market economy that we currently have here in the United States will allow businesses to make this economic decision for themselves on whether or not they require their employees to be vaccinated. However, we recommend that all private businesses post signage about if they require their workers to be vaccinated or not. Ultimately, this will protect them from being sued and create this sense of enter at your own risk and will allow each individual to decide for themselves. On the stance of public schools, we believe that the decision should be left up to the governing body, such as the school, the district, the county, or at the state level. However, when it comes to private educational institutions, the choice is up to them as a school or up to their governing body as a whole. As for college athletics, pro athletics, nightclubs, and other public venues, we believe the choice is also up to the governing body as well. But however, we recommend larger groups like the NBA, the NFL, the NWSL post signage about what they require their employees to do. And now Luke is going to talk about the fine line that we need to consider between liberty and safety.
Thank you, Peyton. A careful balance must be achieved between safety and liberty so that these two fundamental rights may be protected and enjoyed. That is the essence of this ethical dilemma. No one should be forcibly compelled to get a vaccine against their will. At the same time, no one should be allowed undue liberty to infringe upon the safety of others. As the ethical foundation to balance safety and liberty, we seek a deontological approach. That is, a view which treats human beings as ends rather than means to ends, making actions moral in themselves regardless of outcomes. In particular, we look to the ethics of Immanuel Kant, who posited in the third formulation of his categorical imperative that every individual will is a universally legislating will. That is, that autonomy is the basis of moral reason. Kant also stated that the autonomous moral will should be exercised within a framework which considers all other people as ends, rather than other people as means rather than ends. That is, a kingdom of ends. In a kingdom of ends, a balance between corporate safety and individual liberty would be reached. Now Caroline will close.
Thank you so much, Luke. Montreat College believes that it would be appropriate to have limits for unvaccinated people. These limits would have to follow certain conditions in order for them to be ethical. The general population will need to have had the opportunity to receive the vaccine. We will need to know more about the immediate side effects of the vaccine. Healthcare workers should be required to have the vaccine. Public schools should be required according to the governing body's mandate, while private schools may decide on their own terms. Also, when herd immunity is reached, limitations may be considered. Thank you again to the facilitators and other teams for sharing your insights today, and stay safe.
Thank you to the four teams for excellent presentations. We now have a few minutes left that I'd like to first give an opportunity to any sponsors or previous judges, moderators who are in the room who would like to make any comments on the presentations generally or specifically or content or the way it was presented. I'll open it then. If we have more time, hopefully, then we'll let the team members talk. Anyone in that category like to make any comments? If so, unmute yourself. Okay, hearing none, we'll now open it to the teammates from the 4 colleges who might want to make comments on the substance of the arguments, or also on the way they were presented, or, well, anything you want to talk about except probably politics. Although this is a political issue, there are some politics involved with it. As you're smiling, you recognize that. Who wants to be brave and go first? I don't think many of you are shy. Well, while you're thinking, I'll just say that I thought the arguments were well thought out. I thought the court cases helped. I thought there were objective, balanced views, that it's not a simple question, just like most issues today, is balancing the rights and the health. So I thought everybody hit really strong on that point. And like I say, it's not an easy yes or no question. I thought the seatbelt analogy was a good one. I guess I'm not supposed to give my opinion. Come on now, somebody unmute yourselves up.
Am I allowed to ask Montreat a question?
Yes, everything's on the table.
Montreat, thank you as always for that excellent presentation. It was very thoughtful, and that's obviously what we've come to expect from you. One question I have is, and this could be answered by all of the teams, given the irrationality that people have shown in this pandemic, not following, signage on stores that say you must wear a mask, or not being at least, rational in the sense of following CDC guidelines, isn't there a concern that people will treat others as ends as they become free riders?
Good question. I'm sorry that the breakout room's going to close in 5 seconds because we got started late, and I think the others must.